Welcome to the in-service training video for the CORTRAK 2 enteral access system. The Avanos CORTRAK 2 enteral access system, or EAS, utilizes tube tracking technology to assist, in conjunction with institution protocols, qualified clinicians in guiding placement of Avanos medical CORTRAK 2 feeding tubes of 8 French or greater into the stomach or small bowel of patients requiring enteral feeding. Contraindications for use. Do not use the CORTRAK 2 enteral access system for patients with implanted medical devices that may be affected by electromagnetic fields. Warning: do not use the CORTRAK 2 near equipment which radiates radio frequency energy in the frequency band of 20 to 300 kHz. The CORTRAK 2 tracing may be influenced by electromagnetic interference from other electrical equipment such as electrosurgical cauterizing equipment, RFID devices, two-way radios, left ventricular assist devices, and other CORTRAK 2 equipment operating in the immediate proximity, adjacent, or stacked. Portable RF communications equipment, including RFID readers and peripherals such as antenna cables and external antennas, should be used no closer than 50 centimeters, 20 inches to any part of the CORTRAK 2. If concurrent use is necessary, this equipment and the other equipment should be observed to verify that they are operating normally. There are 3 main parts of the CORTRAK 2: the monitor, the receiver unit, and the transmitting stylet. The monitor. The monitor shows the relative path of the stylet. A vertical reference line representing a mid-sagittal line of the patient with a properly positioned RU. A horizontal reference line representing a vertical cross-section of the patient's diaphragm. The vertical reference line and horizontal reference line intersect at a point representative of the patient's xiphoid process with a properly positioned RU. Press the Change View button to toggle between screens. Warning: the CORTRAK 2 monitor displays a representation of the transmitting stylet tip path relative to the receiver unit. This representation is not an image of the actual feeding tube position. There are 3 placement views. The anterior view shows a 2D view of the tube path. The lateral view shows the anterior to posterior relative movement of the tube throughout placement. The depth cross-section view shows the drop in depth on the screen. Warning: failure to follow instructions when setting up the CORTRAK 2 equipment, including the receiver unit, can lead to injuries and/or death. The position and track displayed on the CORTRAK 2 monitor is affected by many variables, including receiver unit, RU, positioning on the patient, patient size and build, anatomical variances, and movement of the receiver unit relative to the patient. For example, in an adult patient, if the front foot of the receiver unit is positioned at an angle of greater than 20 degrees relative to a patient's spine, and/or if the front foot of the receiver unit is positioned at a distance greater than 10 centimeters above a patient's xiphoid process, then the track displayed may result in the appearance of a stomach placement when the actual feeding tube is inserted in the patient's left lung. Here are the required supplies for operating the CORTRAK 2 EAS: a syringe, lube, tape, the CORTRAK 2 NG-NI feeding tube with electromagnetic transmitting stylet, and the instructions for use. Warning: the CORTRAK 2 does not prevent patient injury due to misplacement of a feeding tube into the trachea or lungs. The CORTRAK 2 does not replace qualified clinicians in the supervision of feeding tube placements and does not replace the need for vigilant clinical assessment during the feeding tube insertion procedure. Setup. Position the patient according to your institution protocol. Place the monitor in position. Connect the receiver unit to the monitor. Connect the interconnect cable to the monitor. Optional: connect the printer to the monitor. Press and hold the power button on the monitor for about 5 seconds. Enter your operator login and password. Press the New Placement button. Enter patient information. Placement of the receiver unit. Palpate the lower sternum and follow it to the xiphoid process. Place the front foot of the receiver unit on the xiphoid process parallel with the spine. To level for the patient, add a towel if needed. Secure the receiver unit with tape. Make sure the stylet is securely seated in the tube. Connect the stylet to the interconnect cable. Measure the length of the tube to be inserted per institution protocol. Lubricate the tube with a water-soluble lubricant. Insertion. Warning: the CORTRAK 2 does not replace the need for vigilant clinical assessment during the feeding tube insertion procedure. To initiate insertion for adults, insert the tube 5 to 10 centimeters into the nasal passage. Press Start on the receiver unit. Wait for the green light on the receiver to blink before advancing the tube. If you see an out-of-range message, be patient. The green dot representing the tube tip is not in range yet. Slowly advance the tube. Observe the tracing location while monitoring for patient or receiver movement. Advance the tube through the esophagus to the stomach or small bowel per physician's order. Incorrect placement. If the tube deviates from the vertical midline, respiratory irritation or respiratory distress occurs, or resistance is met, stop insertion and immediately withdraw the tube. Reassess the patient and notify the physician per institution protocol. If lung placement is suspected, remove the tube per institution protocol. Deviation from downward pathway of the tracing above the horizontal axis and/or patient clinical indicators such as coughing may indicate lung placement. To end the placement, press the button on the receiver unit. Flush the tube with 10 milliliters of water before removing the stylet. Then, remove the stylet. Clean the stylet and store it in the bag provided. Warning: do not begin patient feeding until the desired tube location is confirmed by institution protocol. Printing. Press Print on the monitor. For more information, refer to the Quick Reference Guide, the Instructions for Use, or IFU, and the Operator's Manual. Thank you for watching the CORTRAK 2 EAS in-service training.